It's time for health, your super informative turmeric latte charged, ginseng powered, antioxidant rich natural health podcast with a little twist of lemon. And I'm your host, Greg Newson, naturopath, herbalist, and nutritionist. We're here today for the Vitality and Wellness Centre and sponsored by NatraVital Health Supplements. 100% pure active ingredients, no binders, fillers, or additives. G'day everybody and welcome to the latest episode of Time for Health. In today's episode we're not going to look at a disease per se, but we're actually going to look at an organ. It's a forgotten organ. It's an organ that plays an extremely important, actually an essential role in removing poisons and toxins and acids from the body. But it often sits second, third or fourth fiddle behind the liver, the colon, the lymphatic system, and that organ is the kidneys. Now the kidneys are about the size of your fist and they sit in the lower part of your back, just behind the lower part of your rib cage. Now, most of us will have some sort of understanding that the kidneys are important to remove toxins and waste from the body via the urine. But besides removing toxins, they actually do quite a lot of important other things. They control our acid-alkaline balance. They control our water balance, so our fluid. They maintain healthy electrolytes by regulating sodium and potassium. They produce an enzyme called renin that regulates our blood pressure. They also produce another hormone called erythropoietin, which stimulates the production of red blood cells, and it activates vitamin D, it turns vitamin D into its active form, which is calcitrol. So they're pretty important little buggers, aren't they? Okay, moving on. Looking briefly at the function that the kidneys play in these roles, we know that the blood has a pH, a normal pH between 7.35 and 7.45. And if we get too acidic or we get too alkaline, that can have serious health ramifications. And if it's slightly out of balance, that can lead to more inflammation or degeneration of tissue. The kidneys secrete acids or they secrete bases to keep that homeostasis, to keep that balance within the blood pH. The kidneys also regulate our electrolytes by, if we're low, it retains, or it doesn't retain, yes it does, if it's low it retains the electrolytes like sodium for example, puts it back into circulation. If we've got too much sodium, it will then excrete it out in the urine. So it keeps that balance. In addition, the kidneys play a vital role in our hydration. So if we're quite hydrated, we will do obviously a lot more piddling. We'll go to the toilet a lot more because the kidneys go, okay, we've got enough fluid in the body. We will excrete the rest and we'll flush the kidneys, excrete the rest of the urine along with the toxins out into the bladder and out it goes. But if we're dehydrated, it will retain fluid and hence you may get fluid retention as well with this. And it will retain fluid to keep you from dying. Stop you from being dehydrated. So that's a very, very important role they play. Now, the kidneys produce erythropoietin, which is a hormone that people may know as EPO, which bike riders in like the big cycle races, Tour de France and all that sort of stuff, they were having, years gone by, they were having EPO injections, which then got banned because what that does, it increases the amount of red blood cells the bodies produce, which improve the oxygen transportation throughout the body, which means that you get more strength and more speed and more, longer staying power, so to speak. So hence that was banned in sport. But that's produced by the kidneys. The kidneys also turn vitamin D found in sunlight and food into the active form, which is calcitrol. And the role of calcitrol plays quite an important role in regulating the calcium and phosphate balance within the body, and then that which is essential for healthy bone growth. If the blood supply to the kidneys drops below 30%, you're pretty much going to die. Right? So the kidneys will fail. They can't filter out the toxins and they can't do their job properly. So to protect you from dying, the kidneys produce an enzyme called renin that travels to the liver where it's converted to angiotensin 1 and then travels to the lungs where it's converted to angiotensin 2 and then from there it goes on this next little journey down to the adrenal glands where it's converted to aldosterone. Aldosterone causes the blood vessels to constrict, which means that the heart has to work harder, which then means it's going to force more blood to the kidneys to keep you alive. The increase of blood pressure can actually damage the kidneys, the sensitive cells of the kidneys, and lead to the demise of kidney function. Now, the kidneys play an essential role in removing poisons and toxins and acids from the body. And it's quite a unique way that it does this, so bear with me. The kidneys filter about 190 litres of blood per day, and it keeps about 2 litres of excess water to be filtered out through into the bladder via the urine. Now, the blood flow to the kidneys is via the renal artery, and once the blood arrives at the kidneys, the renal artery branches off to millions of tiny vessels or tiny blood vessels called capillaries, and they all feed kidney cells called nephrons. The role of the nephron is to filter toxins and acids from the body. It does this when the blood enters these small capillaries, and these capillaries are called the glomerulus. Now, the glomerulus has this very fine membrane that allows microscopic particles or small particles, such as water and toxins and poisons, to pass from the blood vessel into another section called the tubule. Once the toxins are in the tubules, they're combined with a little bit of water and then head on down to the bladder, and then they're excreted next time we have a piddle. The tubules also facilitate the reabsorption of the water back into the blood vessels, and along with it, a whole heap of vitamins, minerals, and phytonutrients that the body needs to remain strong and healthy. So it's quite amazing how these kidneys work and keep us healthy. So you've got millions and millions of these cells called nephrons, and these nephrons are fed by millions and millions of small capillaries, and all the blood that flows into the kidneys is filtered, it's clean. All the toxins and acids are removed, goes down to the urine, and then we put in a whole heap of good stuff. It's really important. Now, if this doesn't work properly, which I'm going to explain in a minute what causes the kidneys not to work properly, you build up with toxins. Now, and in a severe case of this is renal failure, kidney failure, and people are on dialysis, so they're on a machine that has to do the work of the kidneys, and that is cleanse the blood, because if not, they'll die very, very quickly. There's 2 types of kidney disease. There's acute kidney disease or acute kidney failure, and chronic kidney disease or chronic kidney failure. With acute, it comes on very quickly, and something has stopped the kidneys from being able to get enough blood to them to filter properly. Now, that can be because of you've cut yourself and you're bleeding out, so you've got a severe laceration and you're losing a lot of blood. It can be caused by sepsis, so inflammation, toxicity, a major bacterial infection. A heart attack will cause that, or a physical damage to your kidneys or to the blood vessel to the kidneys that's stopping the blood flow. Symptoms associated with adrenal, where are we going? The adrenals do sit on top of the kidneys. But another story for another day. The symptoms associated with acute kidney failure can be the drowsiness, fatigue, loss of appetite, confusion, muscle cramps, swelling of your ankles and feet, vomiting, reduced urine output, those type of things. If you have anything like that, well, really, if you're bleeding or you've had a heart attack, you know you've got to go to hospital anyway. On the other side of the coin, there is chronic kidney disease, which is the gradual decline of kidney function, and it affects about 11% of the Australian and US population. There are a few common causes of chronic kidney disease, and one of them is diabetes, whether it be type 1 or type 2. The elevation in the blood sugar levels leads to the thickening and hardening of the internal kidney structures and blood vessels, and then that reduces the kidney's ability to remove waste from the body. Another equally common cause of chronic kidney disease is high blood pressure. And what happens is that as your heart has to work harder, that means the force that the heart has to push the blood through the body increases. That then puts a lot more pressure on the artery walls. Well, regardless of what organ is at the end, and in this case it's the kidneys, remember you've got the renal artery that feeds millions of small capillaries, the blood pressure coming through, it should be like a garden hose, but all of a sudden that pressure's now like a fire hydrant hose, and it's just like getting in there and it's just punching, like knocking the kidneys or the nephrons and damaging them. And then when they get damaged, your ability to remove waste effectively diminishes quite dramatically. So what can cause that blood pressure to rise can be fat. So you've got an excess amount of fat around the blood vessels that supply the kidneys, so around your waist, so a beer gut. And if that puts pressure on the artery, the renal artery, and it compresses it, the message is sent from the kidneys. Hey, I'm not getting enough blood. That aldosterone, renin, angiotensin 1 and angiotensin 2 then tells the heart, got to pump harder, and it's this never-ending circle. So one of the ways to fix that is, if you've got a bit of a belly and you've got kidney problems or you've got blood pressure, is lose the belly. Another thing that can cause the blood pressure to increase is cholesterol, especially if that cholesterol is built up on the renal artery. So that means that the amount of area that the blood has to flow through is diminished because the inside wall has been overtaken by plaque. So that means that the internal diameter is diminished, hence lack of blood to the kidneys. Message: increased blood pressure. Smoking is another common cause of kidney disease because it damages the blood vessel walls, which increases blood pressure, and it also increases the plaque buildup on the artery walls, especially if it's down around the kidneys through the renal artery. Obesity can also lead to kidney disease because obesity is linked to an increased risk of high blood pressure and type 2 diabetes. Certain pharmaceutical medications can also lead to chronic kidney disease. Now, those medications are antibiotics. Now, the antibiotics can affect the kidneys in different ways. They can cause an increase in crystals that is very hard for the kidneys to break down, so they can damage the nephrons, and they can also block the urine flow out of the body. Diuretics, which are used to treat high blood pressure, they help to remove excess fluid, can also lead to dehydration, which dehydration, as we know, is not good for the kidneys. Non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, Mobic, Vioxx, Celebrex, Naproxen, they all damage the kidneys. Some of the studies are showing that the overuse of pain medication leads to about 5% of all chronic kidney failure every year. That's a hell of a lot. Laxatives can also damage the kidneys because they create crystals which the kidneys can't detoxify properly, leading to a build-up of toxic waste. Another class of drug that we spoke about in our reflux podcast that has an increased risk of dementia and cancer, plus damage kidney function and lead to their demise, are the protein pump inhibitors such as Somac, Nexium, Losec and Pariet. Other conditions that can contribute to chronic kidney disease is anorexia nervosa and eating disorders, and that's generally because there's not enough fluids coming in and not enough electrolytes and salts, and then there's an increased buildup of acids and toxins that the body can't eliminate successfully. There is an autoimmune disease, and an autoimmune disease is a disease in which our body starts attacking us, so our immune system attacks us. Common autoimmune conditions are psoriasis, Hashimoto's, rheumatoid arthritis. They're all autoimmune disorders. The one that affects the kidneys is lupus nephritis, and that causes a lot of inflammation and scarring of the small blood vessels that filter out the kidneys. So that means the kidneys can't filter effectively. What else can damage the kidneys is if your urine is blocked from coming out. So that means that it builds up in the bladder, and then there's pressure put on the urethras that feed the bladder to the kidneys, and then that urine can retroflow, so go flow backwards up into the kidneys, and things don't filter properly. Now, one of the common causes of a urine blockage is enlarged prostate. And that generally happens in men, not women. So when the prostate enlarges, that then puts pressure, either blocking the bladder or the urethra, as I've just mentioned, and hence blokes will need to go to the toilet and they'll get up and they'll go dribble, 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 or there's nothing and they're up and down 10 times a night. Easily rectified, but quite inconvenient and very damaging, not just for the prostate and the lack of sleep and the full bladder, but the kidneys. Other common causes of urine flow blockages are colon cancer, bladder cancer, kidney stones, and clots within the bladder itself. Talking about clots, a clot is a whole heap of blood cells that have joined together, and they restrict the blood flow to a given part of the body. In the brain, if there's a blood clot in the brain, it's a stroke. That causes a lot of problems, even death. If there's a blood clot to the lung, it's a pulmonary embolism, again, death. If there's a blood clot, we've got the renal artery, and we've got all these millions of other capillaries. If there's a blood clot in the renal artery or in some of those capillaries, or that's blocking some of those capillaries, then that causes the nephrons, they'll basically die, so they're not getting the blood flow and they're not getting the nutrients. That means that there's less workers. Hence, more work that the kidneys have to do, the less toxins that we're going to filter out. Some people can suffer from cysts within the kidneys, and the cysts are little sacs of fluid, and if they then grow, then that puts more pressure on the nephrons and it can damage the nephrons, which then reduces the body's ability to filter effectively as well. They're generally the more common causes of chronic kidney failure, but things like vasculitis, which is inflammation, or basically where the antibodies within your immune system attack your small blood vessels of the kidneys, not quite common, but it can happen, and then that can cause blood and protein in the urine, which then can cause kidney failure. Renal stenosis, which is narrowing and hardening of the blood vessels that feed the kidneys. A condition called scleroderma, which is it's a rare sort of condition, but it makes the skin and the connective tissue hard. So then you've got those connective tissue within the artery walls, and that means they become hard. So it's a little bit like the stenosis, so inability to get enough blood down into the kidneys. Multiple myeloma is a cancer that builds up in the bone marrow and then inhibits the body from making red and white blood cells, which then can damage the kidneys, and it can also create abnormal proteins that can cause the kidney not to function properly. A condition called glomerulonephritis, which is inflammation of the blood vessels within the nephrons, those little tiny filters that are within the kidneys. If there's inflammation there, that then can inhibit the exchange of toxins and nutrients in and out of the bloodstream. The symptoms of chronic kidney disease are similar to acute kidney disease: nausea, vomiting, lack of appetite, fatigue, weakness. You can have problems sleeping, muscle cramps, reduced in mental clarity, the sharpness, urinating a lot or not urinating a lot, swelling of the feet and the ankles, itchy skin, shortness of breath, and that's generally because the fluid builds up in the lungs. Chest pain if fluid builds up around the heart. Now, we've looked at some causes, we've looked at some symptoms. Is there any blood tests that can indicate that the kidneys are not functioning properly? And the answer to that is yes. One of the substances routinely tested by GPs is a substance called creatinine, which is released by muscles through normal wear and tear. The kidneys are the organ that filters the creatinine out of the body. If there is an increase in creatinine, it's a good indication that your kidneys aren't able to clear it properly, hence they're not working as effectively as they should. Another very important test is the glomerular filtration rate, or eGFR, and that measures how well your kidneys are filtering the waste from your blood. And from that test, they can measure whether your kidneys are perfect and they're functioning very well, or they're in stage 1, 2, 3, 4 of kidney failure. The results will be shown for the filtration will be in millilitres per minute. So if your filtration rate, EFGR, is above 90 or above, you've got really great kidneys. But if you start to go between 60 and 89, you're in stage 2 of kidney disease. If you go 45 to 59, you're in stage 3 or 3A, and then you've got 30 to 44 is stage 3B, and then you've got severe, which is stage 4, which is 15 to 29, and then below 15, you're most probably on dialysis. So very important test to see how our kidneys are functioning. And the importance about this is it also shows us what we can do to improve our kidneys, which I'll get to in a little while. And then you'll be able to see those results on your blood test as well. Other blood tests that also indicate that there could be an issue with kidney function are urea and urate, or uric acid. And if those levels are high on a blood test, that tells us that the kidneys is not able to filter out those chemicals effectively. If you've ever had gout, it's a buildup of uric acid, and that is a good indicator that the kidneys are not filtering and functioning effectively. If you suffer from acute kidney failure, there's a lot that medicine can do to reinstall or restart the blood flow back to the kidneys. But if you have chronic kidney disease, there's not much that medicine or pharmaceutical medication can do to improve the quality and function of the kidneys. They can really only help at end stage of the kidney disease, I should say, and that is dialysis, where the machine filters your blood and removes the toxins, or it's a kidney transplant. Thankfully, Mother Nature is on top of her game, and there are some great foods and herbs that help to regenerate and revitalise kidney function and enhance the blood flow back to the kidneys so it can filter the body effectively. Before we look at the foods and herbs that are going to benefit the kidneys, let's look at natural medicine views the kidneys. In Chinese medicine, the kidneys are the source of qi, which is energy, for every single organ within the body, whether it be the heart, the liver, the spleen, the intestines. All of that qi comes from the kidneys. The way I explain the kidneys to patients in the clinic is, yes, they are a filter and they are part of an important filtering system. They do other things as we've just discussed, but one of their main roles is to filter. And they are one of a few unique organs that do this filtering within the body. So there's the digestive system, which filters toxins out via the colon, out through the bowel. There's the liver that filters the blood, the immune system that filters out bacteria, viruses, parasites, allergens, the lymphatic system through the lymph glands, and the kidneys through the piddle. So there's a whole heap of signs and symptoms that tell us whether these filters are working properly. So with the digestive filter, there can be constipation, diarrhea, abdominal pain, bloating, gas, flatulence, reflux, heartburn, loose stools. The liver, it can be angry, irritable, frustrated, annoyed, moody, depressed, anxious, tired and gritty eyes, poor concentration, poor memory, poor focus, poor learning. The immune system, recurring colds and flus, infections, autoimmune disease, candida, thrush, cancer, inflammation, any disease that ends in itis. So if the kidneys are struggling and not working effectively, the signs and symptoms that can be associated with that are lower back pain, arthritis, bone spurs, osteoporosis, ringing in the ears, large amounts of earwax, low libido, recurring urinary tract infections, fluid retention, so swelling of the hands and feet. Your urine can have a strong smell. It can be dark and scanty, so there's not a lot of urine. Kidney stones, chronic fatigue, fears and phobias, snoring, vertigo. The urine can be cloudy. There can be muscle aches and pains. There can be blood in the urine. It can be foamy. What else is there? I can't remember all the rest, but that's quite a lot. So those are good classic signs and symptoms that if you have, that are just an indication that your kidneys may need a little bit of a tune-up. But the problem might be that some of those filters upstream, whether it be the colon or the liver, are not carrying the load, and then there's more load for the kidneys to have to deal with, and they're then starting to struggle. If we look at the foods that are beneficial for kidneys, I'm going to break that up into two sections. I'm going to break that up into the section that if you're like me and you just want to keep your kidneys healthy, there's certain types of foods that are going to be beneficial for you. But if you suffer from chronic kidney disease, there's certain foods that I would think is very beneficial and healthy that might not be beneficial for someone with chronic kidney disease. And they are foods that are high in potassium. So there's lots of fruits and vegetables high in potassium, say bananas. And that can lead to hyperkalemia, which is a buildup of potassium because the kidneys are the organ that filters the potassium. That then can lead to muscle weakness, numbness, tingling, nausea, vomiting, chest pain, shortness of breath, heart palpitations. So we've got to be mindful of those type of foods. The other foods that we have to be mindful of are foods that are high in phosphorus. And if you have too much phosphorus, which the kidneys have to clear, that can cause, if you have too much, a build-up in the blood, and then that can cause a pathogen called calciprotectin particles to increase, which then can lead to cardiovascular heart-related type problems. And those heart-related problems then can cause or exacerbate or worsen your kidney problems. So, foods that are good for the kidneys. One of my favourite is watermelon. And why watermelon? Well, it's high in water, which is good because it helps flush the kidneys, and it's very high in electrolyte, which helps to make the kidney's job easier when it's trying to balance those. Beetroot, another favourite, and I'm not talking about the tinned stuff, I'm talking about the fresh beetroot, which increases nitric oxide, and nitric oxide helps blood vessels to expand, so they open up. When your blood vessels open up, you lower blood pressure, which is great. So this is good to help strengthen the kidneys, and it's also good if you've actually got chronic kidney disease because it will help reduce blood pressure, which can then be damaging the kidneys. Word of warning, they do contain xolates, which if you're susceptible to kidney stones can increase the risk of kidney stones. Funnily enough, kidney beans. Actually, all beans are shaped like kidneys, so Chinese have used those and other Asian countries have used those for thousands of years to nourish the kidneys. So who would have thought kidney beans are beneficial for the kidneys? Fatty fish can also benefit the kidneys because it contains omega-3 fats. Omega-3 fats help to lower blood pressure. Cabbage, capsicum, dark leafy greens, kale, spinach, sweet potato, cauliflower, asparagus, broccoli, plums, pineapples, peaches, strawberries, raspberries, rocket, onions, cucumber, celery, they all benefit the kidneys. So what I'm trying to say there is there's lots of fruits and lots of vegetables that all help improve kidney function. So I could sit here and most probably list 10,000 of them, okay? But one thing that I haven't mentioned is water. Now, water, people don't think is food, and it's not. But it is still the second most important nutrient after oxygen for the body to keep us alive. And it is paramount to flush the kidneys. You can add lemon, lime, grapefruit, or whatever you want to your water to make it taste nice. Herbal teas, and we'll get into herbs in a minute. I also put them in the same category as water, as with fresh vegetable or fruit juices, not the stuff you buy in the shop. Soft drink, alcohol, caffeine, they're all no-nos for the kidneys. It's very hard for the kidneys to break those down. Even though the liver's there to help, it still places a great strain on kidney function and its ability to detoxify us properly. Now, fruits and vegetables and herbs are very high in things called antioxidants. Antioxidants are substances found in obviously those foods that protect our cells from damage. So in the kidneys, the antioxidants play a crucial role in preventing the nephrons, the filters within the kidneys, from being damaged by the poisons that they're trying to filter. So the antioxidants bind to these toxins and render them harmless. But if you already have chronic kidney disease, there's certain foods that you can't eat because they're either high in potassium or they're high in phosphorus. And the kidneys are the organs that I've mentioned that filter those minerals out of the body. And if they can't, those levels rise and then they can cause health problems by themselves. So foods that are high in potassium are numerous, and I'm just going to give you a few. Dried fruits such as raisins, sultanas, apricots, figs, your beans, your lentils, your avocados, your green leafy vegetables, bananas, they're a very big source of potassium. Nuts such as almonds and cashews, there's chicken, salmon, tomatoes, coconuts, oranges, spinach, broccoli, potatoes, sweet potatoes, the list goes on. There are foods that are lower in potassium and can be eaten by people with chronic kidney disease, and they're things like blueberries, whole wheat pasta, cabbage, eggs, chia seeds, white rice, which I'm never a fan of, but anyway, white rice. Goat's cheese is an alternative to dairy. The other mineral that people have to avoid if they've got chronic kidney disease is phosphorus. So they're foods found in things like sunflower seeds, pumpkin seeds, nuts, your meats such as pork, chicken, turkey, seafood, any of your organ meats, dairy, whole grains, soy, beans and lentils. Besides finding it naturally in food, we've decided to inject it into processed meats as an additive to keep the meat more tender and juicy. We add it to cola drinks as a synthetic phosphorus. It goes into baked goods as a levering agent, and it goes into convenience or fast foods to help them preserve longer. So you get a double whammy there, don't you? Nature and man. This is why it's very important to keep our kidneys healthy now. You know, oh, my kidneys are fine, I don't need to worry about them, there's no dramas, I'm piddling, yeah, that's fine. But it's so much more than that. If you get to 50, 60, 70 and you're on a restricted diet, that life is not as enjoyable, but your kidney health declines. Well, when your kidney health declines in Chinese medicine, the kidney is the source of energy. Your whole energy system starts to weaken. You get tireder. Your immune system becomes weaker. You can't handle stress as well. You can become deficient in red blood cells. Your body may not be able to convert vitamin D to its active form effectively. Your blood pressure can go out of control, which increases the risk of heart disease and stroke. Your kidneys have a reduced ability to regulate fluid effectively, and then you get fluid retention. You can get swelling in the ankles, the legs, the knees. You become more acidic because your body or your kidneys can't balance the pH effectively. So what loves an acidic environment? Inflammation and cancer. Inflammation drives cancer, but inflammation also upsets immune function. People with arthritis, inflammation. People with dementia, inflammation. People with cardiovascular problems, inflammation. People with diabetes, inflammation. Inflammation is a cornerstone of every chronic disease. So please look after your kidneys. I don't want to be treating you later in life for something that's easily preventable now. If we look at herbs that help improve kidney function and protect against chronic kidney disease, Chinese medicine has a few great ones. They are dongguai, astragalus and romania. Now dongguai increases the production of EPO, which stimulates the production of red blood cells. It protects against kidney stones, improves blood flow to the kidneys, improves renal stenosis and prevents renal fibrosis, which is the hardening of the nephrons within the kidneys. Astragalus increases the glomerular filtration rate, so the ability the body has to filter toxins effectively. It decreases protein in the urine, improves fluid retention, protects against renal fibrosis, and improves renal stenosis. Whereas Romania, again, improves renal stenosis and prevents renal fibrosis and protects against chronic kidney disease. Other herbs that help improve kidney function is St Mary's thistle or milk thistle that's been used for about 2,000 years to improve kidney function and detoxification. Plus it also protects the kidney cells against chemical and alcohol damage and oxidative stress. The good old humble weed that grows in everyone's lawn, dandelion, brilliant diuretic, which means it helps the kidneys flush the toxins, and it's comparable with the drug furosemide to improve fluid retention. So that's a pretty big call on the part of good old dandelion. But a word of warning, it is very high in potassium. Burdock root, which again has been used for thousands of years, actually opens up the glomerulus and improves the elimination pathways and protects the tubules within the nephrons from damage from glucose or glucose damaging it. Good old stinging nettle is a diuretic and it improves kidney detoxification. And some culinary herbs that you can have at the dinner table every night that are going to be beneficial: ginger, turmeric, coriander, parsley, celery. There is so many great herbs out there, whether they be food or medicinal, that can support kidney function. As a snack, goji berries are king. They've been used in China and the Himalayas for thousands of years as a tonic to nourish, support and strengthen the kidneys. They're also a very potent antioxidant which protects the kidneys from damage and oxidative stress. Chlorella, spirulina, barley grass, alfalfa, all green type foods. The green type foods help the liver and the kidneys eliminate toxins effectively. So if there's heavy metals, chemicals or toxins, they will bind to them and safely eliminate them through the kidneys. Green powders are also high in chlorophyll. Chlorophyll helps the kidneys to balance our pH and make us less acidic. In the clinic, when treating people that have kidney problems, I use 3 core nutrients to help improve kidney function. The first one is Natural Kidney Support. It's a herbal tonic. It contains 10 different herbs that improve various aspects of kidney function. With that, I will include Natural Antioxidant Support, which is a blend of 11 different fruits, vegetables and herbs that are very high in antioxidants. Goji berry is one of them. That protects the kidneys from oxidative stress. And oxidative stress is a chemical reaction that can damage cells, whether it be brain cells, liver, kidney, spleen, intestinal, or the heart. So what causes oxidative stress, you may ask? Well, it's any toxin, poison, or chemical, whether it be preservatives in the food, alcohol, drugs, cigarette smoke, pollution, or even the metabolic byproducts of our own diet. And all this can cause serious damage. Antioxidants are our knight in shining armour that protects us. And they are found in abundance in fresh fruits, vegetables and herbs, and they play an important role in quelching oxidative stress, or as I like to call it, rusting of our cells. Now, oxidative stress plays a major role in poor health and is often the backbone behind many health conditions, including chronic kidney disease, cancer, heart disease, diabetes, dementia. Anyway, I'm rambling. I'm sorry. I've gone off track a little bit there. The other product that we recommend or that I give to patients is Natural Vital Green Cleanse, which is a blend of spirulina, chlorella, barley grass, wheatgrass, something else. I should know it, but I don't. Sorry. And they help improve the detoxification pathways. They balance the pH, help to balance the pH because they're quite alkalizing. They're very rich in nutrients. They're very rich in chlorophyll, and they help remove toxins effectively from the body. So I know I've wasted a bit of your time, and hopefully you've learnt a bit. It's been about half an hour or so. So thanks for listening. And because you've listened and you've got this far, I'm going to give you a special discount code for those 3 products that I mentioned: Natural Vital Kidney Support, Antioxidant Support, and Green Cleanse. For when you go to either the Vitality and Wellness website or the naturalvital.com website, simply put this code KPC001 in at the checkout and you'll all get 15% discount. So thanks for listening. And before I go, the legal component of this podcast: any information that I've given you is purely educational and not meant to treat, cure, or diagnose. Please consult with a healthcare professional before taking any supplements recommended in this podcast. Until next time, this is Greg. Love life and laugh loud.